Good evening, everyone. This is Dr. Bhupesh from Dr. BKM OET Institutes. Today, we are going to cover a bit of a topic about OET speaking. Please subscribe our channel if you have not until now for the best OET guidance and for the best OET coaching. This is the role play card we have done today for our students that there is a nursing setting in the community health center. So the patient is a 30-year-old university lecturer who has recently, that means 2 weeks ago, had his lower bowel removed due to the Crohn's disease and has been fitted with a colostomy bag. The patient's vital signs are fine. That means patient is doing well. The surgeon has informed that patient that wearing the colostomy bag is irreversible. That means the lower bowel has been removed, and now he has to wear colostomy bag, which is irreversible. The patient appears depressed because obviously to wear an extra bag out of your body is something that is challenging for everyone. So patient is depressed. Greet the patient and ask how he's feeling. So you will say, "Good morning. My name is Bhupesh. I am a nurse over here. So how are you feeling today, Mr. John?" "Oh, well, nurse, I'm not feeling really good." "Oh, could you please explain me what happened, Mr. John? Why are you feeling bad, or why aren't you feeling good?" "Well, nurse, see, as you know, I have underwent this operation where lower bowel has been removed, and now doctor has told me that I have to wear a colostomy bag, and that is irreversible. So I'm really worried about that." "Well, I do understand, Mr. John. Whenever anything like this happens in anybody's life, obviously it is a challenging situation. So first of all, you need to be with the patient. That is known as sympathetic or empathetic. But you have to behave as if you are also feeling bad, but again, as a professional, no, don't slow down your voice too much. So again, "Good morning, my name is Bhupesh. I am a nurse over here. How may I help you today, Mr. John? How are you feeling today?" "Well, nurse, I'm not feeling too good." "Oh, could you please tell me, Mr. John, what is the reason that why aren't you feeling so good?" So always try to speak the same lines. It will make your speaking more fluent, more easy. "So could you please tell me why aren't you feeling good? Like what happened?" "Well, nurse, you know that I recently underwent this surgery where there was a surgery for the lower bowel, and now it has been removed and it has been replaced by a colostomy bag. And your doctor has told me that I have to wear that bag forever, so I'm really kind of depressed." "Well, Mr. John, first of all, I really understand that when anything like this happens, obviously it is a challenging situation, so I can really feel for you. But at the same time, Mr. John, that is the only thing that is important for you at the moment, because your condition was such that doctor has to take this decision. So you have to support the doctor that your condition was such that doctor has to take this decision, and now obviously colostomy bag is the thing that will help you. And then the second part is explain that concerns, but explain why the colostomy bag is required. Again, I understand when you get a topic like this, but if you get that in the final exam, you always will have the reason that why colostomic bag is given. Like in the final exam, you cannot have a topic where why is given. Means they will give you points in the brackets. That why colostomy bag is needed, so that would be given in the brackets. Explain sympathetically that wearing bag is irreversible, then you have to be sympathetic with the patient. And I am afraid to say, Mr. John, that you are right. And doctor has told you truthfully that yes, wearing this bag is irreversible. So I can understand. Then you have to empathize with the patient while informing the patient that although lifestyle changes will be need to be made, his fears are unnecessary. So you can tell. So proceeding further, I would like to tell you, I understand, Mr. John, that you have to make some lifestyle changes which are permanent, that you have to carry the colostomy bag forever, but your fears are unnecessary because you can hide the bag under your clothes, so nobody will be able to notice that bag. So please do not feel that fearful, because if you will wear the bag under the clothes, nobody will get to know about it. So it will not disturb your social life, and also we will be here to counsel you every now and then. So you tell we are here to support you, to counsel you, and at the same time you can hide the bag under your clothes. But again, if it comes in the exam, this reason will be given as well. So in the final exam, there would be nothing about your knowledge, it's about your fluency. Then then about the management of stoma and bag, it's just the same thing, that you have to take care of it, you need to keep it clean. and you need to maintain the hygiene. And also, if there is anything that you notice is abnormal, then in that case, you need to inform to our hospital immediately. So any operation that happens, you will always say that you need to inform to the hospital immediately if there is anything abnormal. Otherwise, you should keep the hygiene high and this thing. Tell the patient that community health is available. Also, I would like to mention that community health assistance is always available whenever you need it. And also, I would request you, okay, this is a topic for Mrs. So I will say Mrs. Sylvia, whatever name you can say when it is not given. Also, I will encourage you, Mrs. Sylvia, to come back in 3 days' time for another assistance session so that we can help you to psychologically overcome your fears, and also so that we can help you to have a better life. So again, always complete the topic in positive way so that we can help you in a better way, and psychologically also we can support you. So I hope you have understood everything. This is the main thing. Summarization is very, very important. Some people get 340 marks in OET speaking. The main reason is summarization. So I hope you have understood everything, Mrs. Sylvia. Yes, nurse. Okay, then I would like to tell you, I understand, Mrs. Sylvia. I would like to highlight the key points. I understand this is a tough situation for you, but at the same time, it is a new thing and it is a transition phase. You will slowly and slowly get used to it, and also you can hide it under your clothes so that nobody can notice it. And please, you don't have to be embarrassed about it, because it is something that can happen with anyone. So you should not be embarrassed. And for any psychological support, you can always contact us, and also have fixed your next session after 3 days time. So would be expecting you over here after 3 days. Is it all good? Okay, Mrs. Sylvia, take care. You never say thank you so much. Again, I always mention these 2 points. Summarization is very important, and you don't say thank you so much. And these are the main points when it comes to OIT speaking. But it is not our final exam, so we can also go on Safari to check it out, colostomy bag, and to get some knowledge. Again, gaining knowledge is one of the things you can do for any topic you have got. But again, I do not mean that you can get any topic like that where it is not given, you know. So everything would be given, so you don't have to worry. So colostomy bag. Okay, I will type it. Colostomy bag is this. A colostomy is a surgical procedure that bypasses the part of the colon and redirects the poop to come out of a new hole in your abdomen called a stoma. So stoma is the bag where it will come and it will through your tummy. What is the colostomy bag used for? To collect your poo. Hope often change. How often it needs to be changed? Close the bags may need changing 1 to 3 times a day. There are also drainable bags that need to be replaced every 3 days. So these are the points that would be given in the exam, that you have to replace your bag after 2 to 3 days. And also closed bags may be required to be changing 1 to 3 times a day. Okay. Then also, why do patients go colostomy? So as you had this inflammatory bowel syndrome or whatever, so it was blocking the pathway. So doctor had only this choice to do this operation and to make your life little easier. So that is what you can say. Okay, guys, you can live a long life. There is nothing to worry. If colostomy did not cure the condition, such as certain types, you may still need an ongoing treatment. In many cases, ostomies are either temporary or curative. So these are the things. All right. So basically, you can talk to the patient that it was very important at this stage. There was no other option for the doctor. This was the best option. That is why doctor performed this particular surgery. And please try and understand, doctor did everything for your benefit. So always support your medical staff. That is one of the primary things that OIT would be watching. And even in your real life, your colleagues or your peers expect that you are going to support. So this is very important to support your medical staff, to support your medical protocol, at the same time making sure that patient is not getting upset. So these are the important things. So OET is looking out for communication, not for your knowledge. So in the final exam, if you will get a topic like this, they will explain you everything. But over here, topic was not here. So I understand, even if you would have finished the role play in 3 minutes, that's fine. In final exam, obviously everything would be given, so you don't have to worry. I hope everybody has understood. This is Dr. Bhupesh from Dr. BK Moit Institutes. Subscribe our channel if you have not. And our number is +917696734256. And you may contact us for the best OET coaching. Thank you very much.